Okay, good afternoon, everyone. My name is Yohani Kapeding, and I'm from the UP Manila Standards and Interoperability Lab, or UP Manila C-Lab team, a team dedicated to helping the country achieve universal healthcare through digital health capacity building. Our mission is to make quality data accessible to the right people at the right place and at the right time. In line with this mission, allow us to share with you a vision that we have of providing quality health services through the use of health technologies. So when I was a rural physician in Samar, I was able to visit an area called Seven Hills. I know it sounds like an idyllic name, but it was called that because you literally had to cross 7 hills, or sometimes it seemed like they were more like mountains to get to the nearest barangay. It was a 5-hour trek through mud and slippery rocks. Our team had to carry boxes of medicines and supplies for the whole village, knowing that they are rarely covered by any regular health services. Upon reaching the village, we started seeing patients. And I remember one patient in particular, a 70-year-old farmer who had advanced gout. His hands were swelling and he could barely move them. I asked him if he ever had his hands checked, and he said never. He lives a couple of villages away, and when he heard that we were coming, he walked for 2 hours to see a doctor for the first time in his life. Many Filipinos like Tatay live in remote and disadvantaged areas similar to Seven Hills. These communities often are several hours away from the nearest health outpost and are only reached by traversing treacherous terrain, making it challenging for them to receive timely and comprehensive medical care. This results in delayed diagnosis and treatment, high opportunity costs of travel, and decreased overall health outcomes. And despite the increase in overall internet and mobile usage in the Philippines, millions are still without workable cellular coverage. Every day, these Filipinos are being left behind, and every day, health inequities are further widened. Our response is RxU, Bridging Universal Healthcare and the Underserved Communities. Our offering enables underserved patients to receive timely medical advice, access to life-saving drugs, and safer patient referrals. By leveraging open radio access networks, we'll connect patients in geographically isolated areas with qualified healthcare professionals, extend the range of drug delivery drones, and track patient referrals. These interventions combine to form a comprehensive set of services aimed at supplying end-to-end care, addressing gaps in the service delivery felt by remote communities. According to the most recent DOH data, there are 11 million Filipinos living in geographically isolated and disadvantaged barangays. While this already indicates a substantial total market size, we aim to focus more on a section of this market, those who do not have access to internet or mobile signals and who are not typically reached by health providers. To acquire customers, we will employ a multifaceted approach. Firstly, we will collaborate with the university's large network of healthcare providers to create awareness about our telemedicine service. Additionally, we will implement targeted partnerships with local government units and national initiatives, such as the DOH's Doctors to the Barrios program. To ensure customer retention, we will focus on providing exceptional patient and provider experience and increasing the resources of our partners by addressing the missed income from PhilHealth, all while enabling better access to medical care. While there are existing telemedicine services in the market, our unique differentiators set us apart. First, our platform is the only one specifically tailored to address the needs of remote areas. Our services are accessible and reliable even in low bandwidth locations. Second, most of our competition are standalone services. From our experience, remote areas would find it hard to handle multiple health technologies and even harder for them to make them seamlessly work together. We are the only one aiming to deliver a package of services. The team working on this is composed of experienced health professionals With diverse skills and experience in healthcare provision in geographically isolated areas, innovations in medical devices, and business development. We are building on C-Lab's network of movers and shapers in public health policy, funding agencies, telemedicine, and health technology innovation. And as an organization under the National Institutes of Health, we not only learn from our processes through research, but also influence national policies. Not only do this give us a competitive edge in this niche market, but also the capability to make an impact beyond a business case. With your support, we can create a future where healthcare no longer knows boundaries, a future where no one is left behind.